Hi, my name is Amy, and my informational speech is on drug-addicted teens and young adults. Teens typically start using drugs for many different reasons. Some try it out of curiosity or because of peer pressure, even to improve their athletic abilities. Others may have tried or started using drugs because of other reasons like physical, emotional, or sexual abuse, or even a traumatic experience. Still, some start because of the family history with drugs, drug use or abuse, and or mental health issues. As a general definition, you are a drug user if you take any psychoactive substance. According to the United States Department of Agriculture, at some point it becomes abuse to many people that are unable to control the dependency that typically comes with it, and it becomes something that takes over their lives. Being addicted to drugs can affect every facet of your life, from school, parents, work, and everyday life. It causes emotional problems with relationships and makes you feel hopeless and helpless, ashamed, confused, and isolated. Without the proper treatment, this can lead to deep depression and even suicide, because teens are not old enough or mentally equipped to be able to handle these types of situations at that age. One major concern regarding drug use and abuse is the long-term effects that drugs have on the brain. There are synthetic and designer drugs that have not been out long enough for them to be studied for their long-term effects on the brain. From what they do know already is that drugs make the body produce more dopamine that triggers feelings of pleasure. Robinson. This leaves one feeling the needs and desires for more and more, and thus addiction. The day-to-day concerns are the teens and young adults using whatever amounts of drugs they feel they need to get high, and at times that could be a lethal dose, and that could even be a mixture of more than one drug. Take basalts or methylene dioxypyrovalerone, MDPV. This is a somewhat new synthetic drug that has emerged. It is being made with illegal substances and some legal substances not intended for human consumption. According to Matt McMillian on WebMD, exactly which chemicals that are in the body or in the drug isn't known. The drug can be snorted, mixed with food and drink, or shot with a needle. Some of the effects are high blood pressure, high pulse rate, hallucinations, chest pain, paranoia, agitation, and suicidal behavior. McMillian. Suicide has been noted after a few days of use, but is still being researched to see if there is a connection to the drug. Some of the interpersonal skills needed to work as a mental health counselor working with drug-addicted teens and young adults are communication, assertiveness, conflict resolution, and anger management. Communication skills are necessary to make sure you're listening completely to the client and are also speaking to them in an effective manner. You must be able to express yourself and your rights without violating others' rights, called being assertive. In order to help resolve the client's differences or issues, you must be skilled in conflict resolution to have a relationship with the client. Lastly, you must be able to recognize anger and only express anger accordingly and professionally. Therefore, it is important to have anger management. This helps with completing goals, solving problems, and handling emergencies to protect your clients or your health. Some of the barriers associated with helping teens and young adults with getting clean from drugs are the doubts of the effective counseling, comfort with uncertainty of the mental health counselor, trust, financial concerns, social stigma, and cultural differences. According to Vogel, Wester, and Larson, to change this, there is a need to clearly identify the factors that lead individuals to avoid seeking professional help. Kushner and Scher, 1989, found that individuals who needed counseling or psychotherapy but had not sought it had the highest level of treatment fears, suggesting that avoidance factors can inhibit help-seeking behavior. Therefore, barriers may come down quicker if the apprehension to therapy is resolved and the stigma to mental health treatment is diminished. Drug use is on the rise, especially with teens and young adults. The following chart depicts the marijuana past year use versus perceived risk among 12th graders. And as you can see, the perceived risk is much lower than the proven past year use. The past year use is in the blue. Perceived risk is in the pink. Mental health counselors are in high demand to help fight this growing trend. As a mental health counselor, drug and alcohol abuse is one of the things they use to clients to fight. Mental health counselors also help people with problems like Woodside and McLam 2011, family conflicts, suicidal thoughts, feelings, stress management, depression, problems with self-esteem, issues associated with aging, job, career concerns, educational decisions, and issues of mental and emotional health. Thank you.